Hi, Thyroid Bootcamp members. This is Dr. Patel. Today I'm going to be talking about a very important topic and relevant not only for thyroid disease, but many other chronic conditions, something known as leaky gut, or also known as intestinal hyperpermeability. This topic has gained a lot of attention lately because of some of the groundbreaking research that's coming out that's implicating leaky gut to chronic conditions. Thyroid disease is one of the most common autoimmune conditions on the planet, and that's where leaky gut really plays a significant role. It's not uncommon for someone to come into my office feeling this way, as the image implies. People are frustrated, they're agitated, they're looking for answers, and unfortunately, they might not find them in a traditional practitioner's office. One question that I get quite often is, how can my labs be normal if I feel so miserable? If something isn't right, how can my doctor tell me everything is fine? And then you question if your doctor is listening to you. Then, of course, you question what's going on. And then you question yourself. And then you might question something like leaky gut. So today we're going to be discussing this important topic and how it might apply to you. My goals today are to discuss what is leaky gut syndrome, symptoms of leaky gut syndrome, causes of leaky gut syndrome, and also testing for leaky gut syndrome. Some interesting facts about leaky gut is that it's rare for a person with a chronic medical condition not to have leaky gut syndrome. The average person may suffer for years because of doctors simply treating the symptoms and not getting to the root cause, which might be leaky gut syndrome. Now you'll learn that leaky gut syndrome has its own root causes, and those need to be investigated as well. The simplest analogy I can give for leaky gut syndrome is think of a fence with a few pickets missing. In a healthy gut, we see bacteria, microbes, parasites passing along and not entering into the bloodstream. In a compromised GI barrier, we might see these microbes and undigested proteins entering into the bloodstream where the immune system then has to mount an attack. This can be the impetus for autoimmune disease and chronic inflammation and eventually immune overload. So it's very, very important to have this addressed and taken a look at. Symptoms of leaky gut syndrome include facial swelling when exposures to strong smells are there, such as perfumes, cigarettes, gasoline, bloating, gas, cramps shortly after eating, alternating constipation and diarrhea, immune system imbalances, muscle aches, foggy thinking, ADD and ADHD, poor sleep, food cravings, headaches, irritability, arthritis, and also joint aches are common symptoms for leaky gut patients. Now, what you might notice is these are very, very similar to thyroid symptoms as well. Triggers of leaky gut syndrome can include a variety of different things. These might include inflammation of the gut lining as an underlying factor. Gut inflammation is usually instigated by one or several of the following: prescription hormones such as birth control pills or hormone replacement therapy, viral, bacterial, or bacterial overgrowth in the gut, prescription corticosteroids and anti-inflammatories, antibiotics, decreased stomach acid production, gallbladder removal, food allergens, chronic constipation, antacid medications, processed foods as well as foods and beverages contaminated by parasites, fungi, or mold, increased amounts of refined carbohydrates, candy bars, cookies, cake, soft drinks, and white bread, the stuff that I hope none of you are eating. And of course, chronic stress can be a big trigger for inflaming the gut lining, but also eroding the gut lining as well. Increased alcohol and caffeine consumption can also be triggers of gut inflammation and permeability issues. Some conditions linked to leaky gut include autoimmune disease, of which Hashimoto's is the most common on the planet, chronic fatigue syndrome, diabetes, chronic pain, fibromyalgia, sleep disorders, anxiety, depression, poor memory, heart disease, chronic food allergies, suppressed immune system function are all linked to leaky gut, and the research is actually quite overwhelming. Testing for leaky gut can be quite simple. We use a lab called Cyrex Laboratories, and Cyrex Laboratories runs a great lab. It's called Array 2, and Array 2 tells us about the intestinal permeability of the gut lining. It can tell us if there's inflammation in the gut lining, if the tight junctions are being compromised, or if there's gram-negative bacterial overgrowth, which is causing the inflammation and destroying the cells that line the gut. Very, very important test, and it's something that we recommend to essentially all of our patients. Leaky gut, in summary, is important to understand and can result from a variety of different things related to diet and lifestyle. The symptoms of leaky gut can be quite widespread due to the central nature of the problem, meaning that even though the problem is central and focal in the gut, because of the systemic nature of the symptoms, it can lead to many, many chronic conditions, including thyroid disease. New testing techniques can accurately identify leaky gut, and the testing is very important because not only do many people not know they have it, even seemingly healthy people, but it's important to note that when you're getting treated, you might feel better, but your gut might still be somewhat compromised. Keep in mind that when somebody develops a disease associated with leaky gut, there was a period of time when they had a leaky gut and a period of time when they were unsymptomatic. And because of that delay in time between symptoms and disease manifestation, that's a critical juncture because somebody might not even know something is wrong, while at a cellular level, there's this inflammatory process going on. And when you're reversing the disease, the same can be true. The gut might still be compromised, even though it's significantly dampened and the damage has significantly decreased, but there might still be some issues going on that lab testing can identify very sensitively. So it's good to get tested, not just once, but periodically to make sure this problem isn't returning. And therefore, it's important to have an easy to follow, affordable, and comprehensive lifestyle strategy as the most effective approach to leaky gut syndrome. You have to be comprehensive and it has to be easy to follow. And I'm not going to say that it's super easy to follow, because if it was, then you'd already be doing it. But the changes that are required are strategic, they're very, very focused, and they can provide you with an amazing, amazing return on your investment. So it's critical to focus on leaky gut, to quantify it, to address it, and to re-quantify it to make sure that you've taken care of it. The question I get the most often is, why didn't anyone tell me this? And the answer is one that I'm still looking for. Most clinicians don't know this or are not trained in how to address this issue. And at one point, we weren't either. And it wasn't until we realized that our patients needed this that we got the additional training that was required to understand how to address leaky gut syndrome, how to quantify it, how to measure it, how to fix it, and how to guide patients towards better health so that they can have long-term outcomes when it comes to their health instead of just short-term fixes. So thank you for joining me on this short video. This is a very high-level video that covers just the basics when it comes to leaky gut syndrome. There is a more advanced video that is on our YouTube channel that you can watch later, but this gives you an idea and at least an introduction into why leaky gut can be an important area for you to quantify, and if you have it, to address. Thank you so much for joining me. I hope you found this video informational and beneficial. Feel free to share it with others who you think might benefit. And until the next video, I wish you an amazing day.